the way we provide healthcare today, it's a lot different than it was 5 or 10 or 15 years ago. We no longer get paid for what we do to people. We really get paid for high quality care, so care that's safe, reliable, and high quality every day. And payers and patients and providers expect that the care we're going to provide is consistent, and it's all about getting patients well, getting them home and keeping them home. So that's what we get paid for now. It's all about quality, and payers and patients want value from us. So they want the highest quality care at the lowest possible cost they can get.
If you have several people taking care of the same patient, the patient may get conflicting answers and then not know what to do, and then they may not do anything. There are differences between surgeons which create care variations, and that can create communication problems, which is the number one problem we have in medicine, is communication, both between physicians and between patients. So standardizing that, if possible, can help smooth out the care for a patient, decrease confusion, and generally facilitate a better outcome.
The more that you can streamline care, the better the care is that you're going to provide. I think it instills confidence in your staff and in your patients if they get a cohesive message about how things are going to go. I think streamlining care is more efficient, it's more cost effective from an OR standpoint if we're all using the same equipment the same way every time. So I think it really drives a more positive patient outcome.
Having a lot of different minds working on a single patient and a single problem is a benefit to the patient. But when care variation gets in the way of communication between a team member, that's when we need to sit back and start thinking, well, maybe there's some things that can be more standardized throughout the process so everybody's on the same page and it's easier to address the bigger problem, because there's still going to be different providers, differences of opinion, differences in the way we look at things. But if the standard framework is the same, it's helpful.
If you want to know that your care is going to be safe and reliable, and consistent care is something that you can sometimes see, you can feel as a patient. It just feels seamless. It feels like everybody knows what's coming next, and it also means for our patients that at the end of the day, they haven't had complications. They've gotten home in a timely manner. They knew exactly what to expect, and that's exactly what happened for them.
Consistency is very important because we know what to expect, the staff knows what to expect, and the patients will know what to expect. So that's one part. The second is, if you have a proven pathway that works, deviating from that pathway may cause a problem. It could cause an infection, it could cause confusion, who knows, it could cause an injury, depending on what the problem is.
Consistency of care is also important, especially as we develop more multidisciplinary teams where a lot of different providers are caring for the same patient over a period of time. It's nice to have consistency so we know what happened before and we know what's going to happen next, and if there's a problem, it's from an easily identifiable source.
If we have a lack of rational, well thought out system approach to delivering care, we're all over the place. Patients don't get consistent care. We aren't able to track outcomes across the spectrum as well, and so we don't know what works.
It helps the patient because they're receiving the same message from anyone on the team. And it definitely helps us look at our outcomes data, which looking at outcomes data is how we look to make sure that we're doing as well as we think that we're doing. And certainly having a collaborative group of 3 surgeons outcomes, it's a better data set to look at and make sure that we're doing as well as we hope.
We want absolutely the best outcomes for our patients, and less variability is going to mean safer and higher reliable care for our patients. I also think today in our current healthcare system, providers are becoming, and appropriately so, more aware of what the cost of healthcare is, with changes in the way in which we get paid, more healthcare plans where patients are responsible for a bigger portion of the cost. It becomes even more important for us to have very efficient processes with less variability, because this is not just on our pockets, it's on the pockets of our patients. And so it's more and more important to providers who are aware of these costs to try and make this, again, a value process for the patients, high quality care at the lowest cost for them.
If we can standardize the way we're doing something within reason, we can identify then the things that either help that patient do better or hinder that patient from getting better. And you can also use that method to cut costs where it's appropriate. You may find out that you're doing something expensive that's unnecessarily done.
We all want these patients to have the best possible outcome from their surgery, and I think that's where it all comes from.
What I think that this leads to ultimately is better care, better team coherence and understanding. What is it that we're doing and why are we doing it? Shared mental model, incredibly important to teamwork, and ultimately benefits the patient.
Whenever you do things in more and varied ways, it really takes away from the opportunity to produce really high quality care, because you no longer have reliable systems in place. You have a lot less predictability. And so care variation, if we can work as an organization, as a group of providers, or even as an individual provider to examine our own practices and try to find fewer ways, fewer workarounds, more efficient ways to provide care, it's going to do nothing except improve the quality of care we provide and hopefully do it at a lower cost.